prostate cancer is rare in men under the age of 40, and the average age of diagnosis is age 65. Joining me with an update on screening treatment options and more is my guest, Dr. Carol Salem, urologist and prostate cancer surgeon at Scripps Health. Welcome to Evening Edition.
Thank you.
Now, Dr. Salem, what are the symptoms of prostate cancer and how are they different than, let's say, the normal functions that you might experience as an aging male?
Well, that's an important question because there are no signs or symptoms of prostate cancer, at least the type of prostate cancer that's still curable and treatable. So it's really important for men to realize that prostate cancer screening is critical in order to find this type of cancer when it's still curable.
And let's talk about that screening. I know a couple of years ago, PSA testing guidelines changed and men were told not to get, not recommendations, the recommendations changed slightly. When should a man get tested or get that PSA test?
Right. So there is a great deal of controversy surrounding prostate cancer screening, and especially in the past 2 years because of the recommendations by the United States Task Force, who unfortunately were basing their recommendations on a very old-fashioned way of looking at prostate cancer screening. And because prostate cancer is such a slow-growing cancer, in order to collect that data, it had to be collected over many years. So by the time they came out with the data and the information, the way of looking at PSA screening has changed.
So right now, would you, let's say if you're a man over age 40, is there a particular, let's say a mark that you could tell men, go see your doctor about this?
So the general recommendations have always been starting at age 50 for any man. However, if you have a first-degree relative that had prostate cancer, either your father or your brother, then the recommendations are to start at age 40. If you're African American, we recommend that you start at age 40.
Because they have a slightly higher risk, I understand, of developing prostate cancer. Now, what is the risk in general of getting prostate cancer and dying from it?
Right, so the risk of getting prostate cancer as you grow older is significantly high. That's the problem with it. Almost all men, as they grow older, will eventually get at least a low-grade form of prostate cancer, and we've seen that in some of the autopsy data. The problem is with the screening technology the way it is, we're picking up a lot of prostate cancer, and we're not sure which man actually needs treatment, which man can just sort of watch his prostate cancer.
But there's a good survival rate compared to other cancers, correct?
Absolutely, because we've been picking it up at earlier stages with the screening technology. A great deal of men would do just fine watching their prostate cancer. The problem and the statistics you're looking at are for men who have been treated. So
the 98.9% survival rate at 5 years out are men who were treated and diagnosed early enough.
Exactly.
I see.
So, and it's critical to note that 3% of men who die from their prostate cancer is such a large number of men in this country. It's over 30,000 men every year. It represents the #2 cancer killer in this country.
Well, what are some of the standard or treatment options available?
So the treatment options that are available are varied, and we spend over an hour to 2 hours going over these treatment options with every patient that we see that's newly diagnosed with prostate cancer. And it's very individualized how they should look at each treatment option. And it depends on how much prostate cancer they have, what grade of it, how aggressive it is.
But specifically, I know there's surgery, there's surveillance. What are some of the other things?
So specifically, there's radiation, there's surgery, there's a freezing technology. Those are the ways to try to cure a patient of prostate cancer. For patients who we think it's already spread, or patients who we just simply need to slow it down, say in an older gentleman, then we think of ideas like hormonal therapy, taking their testosterone away, some chemotherapy ideas that have come out in the past 5 to 10 years that are very much available nowadays that we never had before. All of those are options.
And then we'll have to end on this because we're running out of time here. How does a man decide how to treat, get the right treatment.
Again, it's super important for them to get as well informed as they can. So once they're diagnosed, they spend the next couple of months meeting with different physicians, their primary care physician, the surgeon, the radiation physician. The neat thing at Scripps is we have all of that to offer the patient. We have, the best of radiation care with our proton beam machine. We have robotic surgery. We have an incredible group of medical oncologists to help them through that.
A lot of options. Unfortunately, we are out of time. There's a whole lot more on our website, kpbs.org. Dr. Carol Salem, thank you so much.
You bet. Thank you.